Hello and welcome to Chapter 13 on substance abuse. This chapter is going to give us quite a bit of information on a variety of different substances that we sometimes don't attribute to being drugs or being controlled substances, but I definitely want to clarify some misconceptions, give you guys quite a bit of information that you may not have already had, let you know how it impacts women's health, how it impacts our sociological views, how it impacts our legal aspects in life, and also bring with you my firsthand experience on substance abuse because I have lived through this via family members. I have actually lived in the house with a drug addict. I have lived across the street from an actual crack house. I have seen what substance abuse does, both illicit drug use, prescription drug use, and alcoholism. I have seen this from a firsthand perspective. And so while my experiences aren't going to be necessarily parallel with everyone else's, I do bring a unique contribution to this chapter, and I hope that you will find much of what we have to say here truly beneficial. Alrighty, let's get started. So the first thing I want to talk about is exactly what is substance abuse and why is it important. So substance abuse is, in general, overuse, misuse, any sort of addiction, any sort of need for these particular substances. And so that can be from a legal drug or an illegal drug. It is still considered substance abuse. There are so many different forms that we have in the United States, and many of them, if not most of them, are preventable. Yes, there are instances where individuals have overdosed on prescription drugs. There are instances where they just didn't know how much they were taking. And those are not the things that we're talking about preventable. Preventable use of substance abuse is primarily associated with illicit drugs and alcoholism. When we talk about drugs and the legal aspects of it, the lines between drugs that are legal and illegal, we have seen that these have changed over the years, and they're actually still changing. California legalized recreational marijuana this year in 2018. It's been legal in several other states, but at the federal level, marijuana still isn't legal. So just because it is in California, if the feds come in, you can actually still be arrested in a state where it is considered legal. So we have prohibition. We have things such as LSD and heroin. And initially, and this is completely shocking, these drugs were actually developed for medical use. And in some capacities, they are used in medicine. But because of the high impact of addiction, we have seen the use scale down from the medical field. We have seen alternatives being given to patients so that they don't become addicted. We just have so many different aspects of legal law or law aspects related to drugs because of addiction that things are kind of always changing, and the hospitals are trying to adapt to people's need for these medicines or continued need that they have imposed on themselves because of illegal use or overuse. Marijuana is legal in multiple states. Like I said, it's still illegal at the federal level. So you have to be careful when you're traveling from state to state, because what's legal in one state is not necessarily what's legal in another. And you're not going to be able to say, well, I bought it in California. If you carry it across state lines, it's considered a federal crime. And that is a whole different ballgame versus what could be considered a misdemeanor in one state. So please be careful if you happen to be traveling with something that you bought from California, or if you bought it in California and you're going back on a plane, just be very cognizant that the rules are different in most other states. And then we have other types of legal drugs that are still detrimental to the body. Alcohol, tobacco, prescription drugs, all of these are actually legal. You can get them legally, but the overuse or the misuse of them is still considered substance abuse, and this happens all of the time. Prescription drug overuse is prime, and we'll talk about some of the stimulants such as Ritalin and Adderall in a moment. Some of the effects of drug use, you see that this is a short list, of course, but there are physiological effects, mental dependence. There's also physical dependence, and that is where the body seems like it cannot function if it doesn't have these substances in them. The crime rates go up for individuals who are addicted to drugs as well, because partially of the addiction factor, partially because of the tolerance factor and the dependence factor. You will do almost whatever you have to do to get some of these drugs. And so crimes actually increase in the area. It was not uncommon for my brothers and sisters and I to walk into the house and find multiple things stolen. Microwaves. I think the refrigerator was gone one day. We had the toaster was gone. Televisions were gone. VCRs, if you're old enough to remember what that is. 8-track tape players, records. All of these things just disappeared out of our house. My mother's pager disappeared on 2 different occasions. Our car was stolen. And so these are the types of things that happen when individuals are on drugs and they really need to get that next fix. They do commit greater numbers of crimes than the average person. There are some other additional things that you can see on the slideshow. I do want to bump down to treatment of medical complications, and these can be contradicted with drug use. Certain medicines cannot be used with others, and if they don't, especially if they don't know what you're on, it's not uncommon for individuals who have had an overdose or who have been suspected of ODing to be brought into the emergency room, and the emergency room physicians and surgeons have absolutely no idea what they have ingested. So that makes treating the problem very, very much more complicated. And as a result, your overall health can take some serious tolls. Other aspects of substance use and abuse, we look at the socio-cultural dimensions, and this is extremely important. So some of the factors increasing the likelihood of drug abuse are significant life stressors. If someone just died, if you lost a job, if you are depressed, if you had a baby, post-traumatic stress syndrome or postpartum depression is also very real for women, and they can abuse their prescription drugs, the ones that are there for pain. If you had a cesarean section, then some of these drugs can be abused after you have a baby. So significant life stressors, sexual and physical abuse. This is extremely common. I think we have to be extremely careful when we judge individuals such as prostitutes on their career choices, because many of these individuals have been abused, and it's easy for someone who is a user or an abuser to recognize an abused individual because they know what to look for. Oftentimes these women who are on the street have been sexually or physically abused, and they have been pulled into these positions as prostitutes, and we know that there is rampant sexual abuse in that community. And so part of the way that some of these women deal with this is through illicit drug use, because once again, drug use has a way of kind of numbing us. That's one of the effects, is a numbing effect. It helps to basically de-stress an individual, relaxation such as marijuana. So it's very common for sexual and physical abuse victims, particularly those who are still living on the street, to engage in illicit drug use. Self-esteem, anxiety, conflicts, depression, being poor, being broke, believe it or not. Drug use is rampant in lower class areas as well as it is in upper class areas. However, it is easy to get drugs in some of the areas where individuals are struggling, and you have a choice. Hey, can I sell this crack cocaine, or can I let my family starve? That was a real thing that happened in the Bay Area, in Oakland, California, in Richmond, California, in San Jose, California, even in Stockton, California. That is my home city. And Stockton, California is a drug haven because the ports in the Bay Area, in San Francisco and Oakland, are so heavily monitored that they can bring that stuff in right on the port of Stockton, and then you have immediate access to the 5 and the 99 freeways. You could peddle those drugs right on up and down the entire state, the entire western seaboard. And so, believe it or not, poor communities have an influx of drugs coming into their communities because it was a way for them to make money. And this was very, 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 very common in the 70s and going into the 80s, where that whole crack epidemic really started to kind of blow up. And then we saw some effects when it came to the minorities communities being processed and sentenced differently in the legal system, because the blacks had crack cocaine and then white communities had powder, and it was literally the same thing, except black communities and black and brown people were being given 2, 3, 4 times heavier prison sentences than were their white counterparts. So these are some of the things that impact our socio-cultural, our legal and our cultural aspects of drug use, because they impact these different areas just dramatically. When we look at some of the additional legal dimensions, we know that it disproportionately impacts people of color. And because of that, partially because of that, they're disproportionately given prison sentences. It doesn't matter if you are a woman or a man. If you are a person of color, you are highly more likely to receive a harsher prison sentence than your white or Asian male or female counterpart. Hispanic and African American drug offenders, they have greater chances of being sentenced. Sometimes when you have a small drug possession, they will give you what's called a pretrial deferment, where if you do X, Y, and Z, you do this community service, you pay a fine, and then your record is wiped clean. A lot of the times people of color are not offered these, whereas their white counterparts are. And if nobody is, they're still given longer prison sentences than their white offenders. So 40 years ago, there was nearly 10 times more women who are currently incarcerated for drug use compared to 40 years ago. There are nearly 10 times more women who are currently incarcerated for drug use. And some of that has to do with the absence of the father in the home, and women can still actually make money selling drugs on the street. This is what happened in some of the poorer communities, in Washington, D.C., in Chicago, in Oakland, in Stockton, California, where individuals who needed money, men and women alike, sold these drugs, and they were disproportionately sentenced. But there are a lot of women in the prison system who are convicted and given sentences because of drug peddling, drug use. And then, of course, there's drug during pregnancy, and we know that that has a severe negative impact on the growing embryo and fetus. Economic dimensions of illicit drugs. I mean, we're looking at 50,000 deaths per year and $200 billion per year in costs. And then we come to $26 billion per year in federal spending. And this is for prevention. I have a problem with this number because we know that drug use is a severe epidemic in the United States, particularly in communities of color. And this $26 billion is not necessarily exhibited in these communities in the forms of treatment centers, fighting drug trafficking and putting more law enforcement, not necessarily just to arrest the person doing the drugs, but we're trying to find kind of the head poncho in charge. And so when you spend a lot of money arresting the little person for smoking crack, smoking marijuana, doing heroin, doing LSD, but you never actually crack down on the person who is peddling it, the big person peddling it, then we still see disproportion in the black and brown communities. Additional economic dimensions of legal drugs. Tobacco is perfectly legal, but we all know what it does to our bodies. The Surgeon General states that these types of or smoking in any form, even electronic smoking, has been proven to cause birth defects. And then we have the additional fact that if you don't smoke, then the secondhand smoke is even more toxic for you. So hanging around people who smoke, if you don't, is even worse than smoking. When I was growing up, you could buy cigarettes in the vending machine. Literally, I could walk into the bowling alley and stick my little quarters in and pull out a pack of cigarettes and walk on down the street and boom. And now they ask for ID, but that's not even universally enforced everywhere. You are supposed to, but not everybody does it. Also, the price of cigarettes has skyrocketed, but because of the addictive properties, smoking is extremely difficult to quit. If you've ever known anybody to try and quit smoking, you know how much they struggle with this. And so that's why we have these economic dimensions. $1,000 per year that's spent on cigarettes, that's a lot. Then we look at the economic impact of alcohol abuse. We have almost $250 million per year, and it's primarily through lost productivity. So it's very difficult to be productive and put forth a good quality product at work or wherever you are. If you're doing something recreational, if you're doing something musical, Hard to do that when you have an addiction and a tolerance and a dependence on any sort of illicit drug, whether it's legal or not. And then just quickly before we go on to the second portion of our lecture, this is just a graph of the individuals who are smoking. And you notice that there are a lot of women who are smoking from age 18 to 65. Those numbers are pretty high. We're looking at least 15% upwards, going up to 20%. And so that's troubling when we look at women and how it impacts our overall health.